My name is Fiona Leonard and I'm the Clinical Specialist Physiotherapist at Ipswich Hospital. This is a short presentation with exercises and advice following caesarean section, aimed to help to prevent postnatal complications and get you back to your pre-pregnancy level of fitness. Deep breathing exercises help to expand the lungs, helping to prevent chest infections and increase oxygen in the blood used by the tissues to help healing. They also help to stop you feeling sick. Try to take 3 deep breaths, breathing in through your nose and out through your mouth every hour, ideally before surgery if possible, and continue with them for the first 10 days postnatally. If you need to cough, sneeze, laugh, etc., bend your knees to take the stretch off your tummy muscles and support the incision site with a rolled up towel and your hands to help reduce pain. Pregnancy hormones and surgery increase the risk of developing blood clots in the veins of the legs and lungs. This increased risk of blood clot continues for 6 to 8 weeks postnatally. To prevent blood clots, it is important to keep your feet and ankles on the move, either up and down or by circling them. Aim to do this 20 times every 15 minutes when you are awake and not moving about. If you get any pain, swelling or redness in your legs, or sudden shortness of breath or chest pain, you must see a doctor immediately, as blood clots can be life-threatening. Postnatally, it is common to pass blood clots from the uterus and vagina. If you pass a clot larger than a 50p piece, try to keep it to show your midwife, as it may mean some of the placenta has been retained. You may be given compression stockings to wear and may have to inject yourself with Clexane to help to prevent blood clots. After surgery, your blood pressure can be quite low, which can make you feel dizzy and faint. Give yourself plenty of time to let your blood pressure adjust as you move from a lying to sitting and then standing position. Try walking on the spot by your bed for a few minutes before walking to the bathroom for the first time, so that if you feel dizzy, you can sit back on the bed. To help your blood pressure and healing, it is advisable to walk about every hour during the day. To get out of bed, roll onto your side, lower your legs over the side of the bed and push yourself up sideways using your elbow and hand. This reduces pressure on your stitches. To get back into bed, crawl onto the bed on all fours and then lower yourself onto your side. Trapped wind is very common after abdominal surgery and can be very painful. Walking about helps to get it moving, as does abdominal massage, where you stroke up on the right-hand side of your tummy, move across the top under your rib cage and down on the left-hand side, moving the wind in the direction that the bowel works. Knee rolling also helps to move trapped wind. Stick to a soft diet, avoiding harsh fibres like Weetabix, brown bread and bran flakes for the first week after the caesarean. The best position for opening your bowels is to sit on the toilet with your feet flat on a little stool or a bag of toilet rolls and have your knees higher than your hips. Support your stitches with your hands. It's very important not to strain. Taking deep breaths can help. Following delivery, your bladder sensation is reduced for up to 10 days. This means you may not get a feeling that your bladder is full. If you let your bladder get too full, it can become overstretched and damaged, which can lead to kidney damage and bladder infections. It is therefore really important that you pass urine every 2 to 3 hours when you're awake, once your catheter is removed. If you can't pass urine, inform your midwife. The pelvic floor is a hammock of muscle that attaches to the pubic bone at the front of the pelvis, passes back between the legs, circling around the openings of the urethra, vagina and rectum, and attaches to the base of the spine. It has 4 main functions. It helps to prevent leakage from the bladder and bowels. It supports all the internal organs and stops them from dropping down, which is known as a prolapse. It is important in sexual arousal and it helps with spinal and pelvic stability. The pelvic floor muscles get weakened by the hormones of pregnancy and by the weight of the baby and placenta sitting on them. To contract and strengthen your pelvic floor muscles, close your back passage as if trying to stop passing wind, and at the same time close your front passage as if to stop passing urine. As you close and tighten up, you should feel a lifting up feeling inside of you. Don't hold your breath or pull in your stomach muscles, or clench your buttocks, or use your leg muscles. To strengthen the muscles to stop you leaking, do 5 quick squeezes 6 times a day, and to strengthen the muscles to stop you having a prolapse, do 5 holding for as long as you can, up to 20 seconds, 6 times a day. Doing it while feeding helps you to remember to do them. Try to pull up your pelvic floor before and during activities which may be a problem, such as coughing, sneezing, and laughing. Pelvic tilting can be started immediately post-operatively. It helps to reduce back pain, strengthens your tummy muscles, and increases the healing of the wound. Lie on your back on the bed with your knees bent, with your feet resting on the bed. Gently pull up your pelvic floor muscles and tighten your lower tummy muscles, and then gently tilt your pubic bone up towards you, flattening the base of your spine into the bed. Then relax off, creating a small curve at the base of your spine. Repeat this 10 times and aim to do it hourly while in hospital, and 3 times a day for the first 6 weeks when you get home. Pelvic tilting can be done in lying, sitting, and standing. Avoid doing it on all fours for the first 6 weeks after delivery, as the cervix remains open and air could be drawn up into the uterus, which can be life-threatening. Knee rolling helps to stimulate the bowels to work and increases the healing of the wound. Lie on your back on the bed with your knees bent and your feet on the bed, and gently rock your knees from side to side as far as you feel comfortable to go. Don't go into pain. Repeat this 10 times and aim to do it hourly while in hospital, and do 3 times a day for the first 6 weeks when you get home. Wound massage can be started 48 hours after your caesarean and is aimed to help healing and reduce swelling and also prevent tight scar tissue and adhesions from forming. Aim to massage around the site of the wound for the first week, doing 3 minutes 2 to 3 times a day for the next 6 weeks. Make sure you wash your hands before and after doing the massage and use vitamin E or olive oil. During pregnancy, as your baby grows, your stomach muscles stretch and then separate. Once you've delivered your baby, it is important to get your abdominal muscles back together again so that they can support your spine and you get your waist and figure back again. Exercise 1. To close the gap in your abdominal muscles, lie on your back on the bed with your knees bent up and your feet on the bed. Cross your hands across your tummy and using your fingers gently pull your tummy muscles together. Hold them there while you pull up your pelvic floor muscles and gently pull your tummy muscles in like you're trying to get into a tight pair of jeans. Hold your tummy muscles in this position for 3 seconds, remembering to breathe, and repeat this 10 times 5 times a day. Aim to start this exercise a week after the caesarean, as for the first 2 weeks after delivery, you still have relaxin circulating, which helps to make the muscles more flexible and easier to pull together. Exercise 2. After a week of doing exercise 1, you can add in slowly taking one knee out to the side, keeping your feet together, while still pulling your tummy muscles together and pulling them in and tightening your pelvic floor. Do 10 on each leg, 5 times a day. Exercise 3. After a week of doing exercise 1 and 2, you can progress on to slowly straightening out one leg by sliding your foot away from you and then bending your knee back up again, while still pulling your tummy muscles together and pulling your tummy muscles down towards your spine and tightening up your pelvic floor. Repeat on each leg 10 times, 5 times a day. Exercise 4. After a week of doing exercise 3, progress to exercise 4. Lying on your back with your knees bent and your feet resting on the bed, pull in your tummy muscles as if getting into a tight pair of jeans, and pull up your pelvic floor muscles. Start with your arms down by your side and then slowly lift them up over your head and then lower them back down again. Repeat this 10 times, 5 times a day. Exercise 5. Hip hitching helps to strengthen your waist muscles, giving you an hourglass figure. Lie on your back on the bed with one leg out straight, the other knee bent up with your foot on the bed. Point your toes on the straight leg up towards the ceiling and then push your heel towards the foot of the bed so you stretch your leg away from you. Then keeping your leg straight and on the bed, pull your hip up towards your shoulder so that your leg is sliding up and down the bed. Repeat this 10 times on each leg, 3 times a day. Make sure when feeding you give yourself time to get into a comfortable position. Sit with your back and arms well supported with your baby at the correct height for you. For the first 2 weeks, try to limit the amount of lifting you're doing to just caring for your baby. If you have older children, try to encourage them to sit on your lap for cuddles. Have a small towel or cushion between them and your caesarean incision. For the first 2 weeks, try to limit yourself to light housework such as cooking, washing and drying up, and dusting. Carry wet washing in smaller loads. Check with your insurance company as to when you can drive again. This is normally between 3 and 6 weeks after a caesarean. Make sure you can do an emergency stop without it hurting or pulling. Walking is a good form of exercise from day 1. Swimming, yoga and Pilates can be started at 6 weeks. More strenuous exercises such as running, horse riding, aerobics and the gym can be started at 12 weeks. Gradually increase the intensity so that you are back to your pre-pregnancy exercise regime by 6 months postnatally. It's important not to do strenuous exercise for the first 12 weeks as you could develop a prolapse. It is safe to resume sexual intercourse once your bleeding has stopped.